First, let me start by saying your committee has been speaking about this issue ever since it started, when the OPD was closed and the increment was done without the approval of Parliament and everything. Yesterday, you had the minister before you. Did he address the concerns you had?
Yeah, thank you very much. Absolutely no. And I want to put it clear that even the minister coming to brief the House yesterday was upon the pressure put by the minority side, especially the Health Committee members, because I remember I was with the Honorable Rankin when we met the minister in his office just to plead with him to intervene because, look, we are dealing with a very serious matter. Patients were suffering, clients were dying, and as we are told, about 19 or so of them have died just because of this unfortunate disruption in healthcare to them. And it's also very sad that this issue is something that has been the public domain. I mean, patients have been suffering for months. And some issues really demand very urgent interventions. And if we listen to the minister yesterday,
Radio Gold.
We are still in doubt because one, he said they have made a request to the Minister for Finance for them to pay the 4 million Ghana cedis, and then said the minister has given approval. We haven't seen that, and I'm not very sure any of you have seen evidence of that approval, whatever it means. We need urgent measures. We need the monies to be paid. Interventions that would ensure that the situations that Korle-Bu Teaching Hospital has found itself will be addressed immediately, and then these patients would have quality health care. The question I asked when I was contributing yesterday was, how come that we are relying on some contract signed, and in any case, Korle-Bu just doesn't exist in isolation without any control measures or kind of guidance from the Ministry of Health? What were the inputs of the ministry? At least one of them will be on the board of Korle-Bu. How did they guide the contract signing process? That he was now saying FMC should they will review the contract, then they should supply the 45 dialysis machines. A lot of things that really, if you analyze, there's still no hope for these renal patients. And going beyond the Korle-Bu, when the minister is talking or answering questions, the answers should be moving towards a policy direction. For now, it is Korle-Bu. Tomorrow, it might be any of these other regional facilities or teaching hospitals. What do? We have to go and continue discussions on renal dialysis for that particular location. No. I thought that the minister would have given direction as to how we are addressing this as a national issue. He didn't do that. So it's unfortunate. I'm talking about he mentioned the private facilities that are charging between somewhere 800, 1,200 or so. Truly speaking, I don't know. I have no evidence of any private facility charging that. If he had, he could have just mentioned the names of those private facilities. What we know is that the other teaching hospitals are not charging that. I mean, go to Konfanochi, Cape Coast Teaching Hospital, go to Brekum, and all those places that they are doing dialysis. They are not quoting figures that are above 400. It's just around 380 there. So how come Korle-Bu alone wants to increase charges from 380 to over 700? So if we give this approval to Korle-Bu, tomorrow if the other teaching hospitals also come, how much are we going to increase that first? And that's what I mean by looking at the issue holistically. Let's bring on board all the stakeholders, discuss the issues of dialysis in this country, and find a lasting solution to this dialysis issue so that renal patients can have quality of health care, in this country. And that's what all that universal health care is about. It's not just words put together where every day we get up as a country, we say we are driving towards universal health coverage. Hello?
So
the line got interrupted. We can't say we are moving towards universal health coverage when even renal patients with such conditions do not have access to health care because they don't have the ability to afford payment. So that is the opposite. What we are doing and what is happening in Korle-Bu is a direct opposite of universal health coverage, because the definition of universal health coverage is that nobody anywhere should be denied quality health care because the person does not have the financial needs. So what is happening at Korle-Bu means that we are not as a country ready to achieve universal health coverage, which is unfortunate. Now, and Korle-Bu is just the tip of the iceberg. I was asking how many dialysis machines have the ministry supplied to the other regional hospitals and teaching hospitals. You don't find any answer towards that. And for how long will we have patients, dying because of this? So we are looking for the immediate intervention, and I'm working at how, when this 4 million, you said the Minister for Finance has approved, will be paid, because in a serious country, he wouldn't just be talking and still making hopeful promises. But we should have seen evidence of releases of the funds hitting Korle-Bu account. Then we know that government is serious.
Now, so for you, the very first thing you want the minister to address is make sure that if this 4 million has really been approved, it should get to Korle-Bu to pay the debt.
Exactly, immediately, because we are dealing with an emergency.
And once that debt is settled, you seem not to have been convinced that the minister has put forward a plan that will ensure that this does not happen again.
That's what I fail to see, listening to him and having read his statement. I don't see that direction. He spoke like the CEO of Korle-Bu Teaching Hospital, making a case and addressing issues of Korle-Bu. And that's what I mean by saying that he should have moved beyond Korle-Bu. After talking about the specifics of Korle-Bu, you now move to the general, where you are talking about policy directions, talking about national direction, so that we know tomorrow we don't come back again discussing either the same Korle-Bu or, we are now at Konfanochi Teaching Hospital or my regional hospital and we're talking about dialysis machines again. No. I pray that we should have a national discussion, apart from what Parliament is doing. We should have a national discussion on this, where all stakeholders make inputs, and then we find a lasting solution. And it should go beyond just the patient. What do we do as a matter of policy? What are the interventions that we can put in place to prevent people from developing renal failure, especially getting to the chronic, because the moment you are being put on dialysis, it means the nature of your kidneys are such that they cannot support your system. So the dialysis has to come in the way of trying to do the functions that the kidney should do. So it means it's more like an end-stage organ failure. We shouldn't wait for our people, for our clients to get there. We should first take measures to prevent people from developing kidney failure. Secondly, where the prevention, probably some people will escape the preventive measures due to other reasons, then we deal with them. But if we allow, at this stage, look at the numbers, even Korle-Bu alone. Now take the national picture and look at how many clients in this country are suffering from chronic renal failure. And by next year, by 2 years, how many more new people would join? As a country, there should be a very clear direction. I always say that, especially this government does not put priority, in the healthcare delivery system of this country. There is only infrastructure, everyday agenda 111 agenda. Meanwhile, we don't really see what the stage of that. But every day, that's what, there's none of their communicators that will go and sit and don't talk about agenda 111. Meanwhile, that's just infrastructure. The other health system inputs and the quality of healthcare is a different thing.
Well, the minister was actually talking about 3 different options. I think one of them is putting it on the National Health Insurance Scheme. There's one also which involves even looking at the tariffs that are charged currently, which are the fees which at some point became a matter of public concern. Which of them are you amenable to? Which of them would you agree to?
As a member of parliament and representing the good people of the Renal constituency, these options are just, what would I say? We're just reacting to a problem now, and none of this really is something that we can see immediate solution, because one, national health insurance absorbing it won't just happen tomorrow. They can only just wake up and make announcement that national health insurance should take it up, just by words of announcement. But we know it takes measures, it takes steps to do that. So it's not something that will happen this year. Meanwhile, we need immediate solution, because you have to do all the actual studies, look at, whether it's something that the health insurance can handle. Will it survive? Because as we speak, the state of the national health insurance is not in any good position. One, it has been capped, so we have to decap it. If we are talking about it absorbing the cost of renal dialysis. So it's something that will take time to look at and address. The tariffs, as we are aware and being told by the renal patients, well, even at 380, the patients are saying that we cannot even afford the 380. What about moving it to 700 and above? And as representative of the people, we won't just go and sit and be looking at what Korle-Bu has submitted without listening to the plight of our patients, of our constituents who are suffering from this condition. So if they cannot afford, what it means is that we have to look at the figure that they can afford. Because bear in mind, this is a chronic condition. It's for life. These clients are vulnerable. They are not working. They are not very strong to work for capital. So they are depleting their capital. Families are depleting the little resources they have. So it will be seriously considered by members of parliament. And I believe at the end of the day, the interest of the patient would prevail. And that's why I'm calling that government should intervene. I mean, what is the fundamental duty of every government?
Ghana's gold.
You have the duty to make your citizens healthy. It's your duty to keep them healthy. So if we get to a stage where there are serious problems in the healthcare delivery system, government has to immediately intervene. Because what is happening is an emergency. It's a sad shame because clients are dying. And look, what also prevents government from removing taxes from these consumables from the port? Government should waiver, because if they don't pay for those reagents and consumables, the price will come down, and that is what we want to see: immediate solution. Then, as a country, we talk about policy measures that will be in the long term to address this holistically. If not, these reactionary measures where we wait something happens, then we are now talking and making promises. That is not a solution in serious countries. It can only be in this country where this government can just simple issue at Korle-Bu, just one teaching hospital. It has taken months. This issue has taken 4, 5, 6 months, and we are still talking.
Doc, thank you very much for speaking to us this morning. I guess we need to have a bigger conversation, like you said, on these issues. And when we've scheduled one, we'd like to take your inputs whenever we're having the discussion. Yeah, thank you. Thank you very much. He is a member of the Health Committee of Parliament, MP Dafemegbu Siesa, joining us this morning. If you're having difficulties with your vision, you are having persistent headaches, you're due for a new pair of glasses or lenses, we are not going. This one, dear, is immediate. Third Eye Care Vision Center is your one-stop solution when it comes to your eyes. When it comes to your eyes, everything that has to do with your eyes, including your eyewear, everything you need. Speak to Third Eye Care and Vision Center with their ultra-modern equipment, well-trained optometrists and staff. Third Eye Care assures you of the best. They also provide comprehensive eye care for people of all ages. They have in stock all kinds of spectacle lenses, spectacle frames, sunglasses, contact lenses, eye drops, among others. They also provide diagnostic tests such as eye pressure checking, photography of the eye, scanning of the bag of the eye. They are also now a DVLA. Third Eye Care is a DVLA accredited eye examination center. So, if you have to do an eye examination for the purposes of a license, a driving license, go to Third Eye Care and Vision Center. Now,